Welcome to Marian Ayurveda. In this episode, we are going to discuss the disease known as appendicitis and the various types of Ayurvedic treatments available for it. Appendicitis is a disease that most of us probably remember with a sense of fear. It is a disease that comes with very severe pain and is often said to require immediate surgery. I will be talking about how Ayurveda can be effective in this condition and what kinds of treatments are available for it. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. In my experience over all these years, I have been able to treat quite a number of patients with appendicitis. In the beginning, I was extremely anxious about how to treat this condition. But the stand I took was that often when appendicitis is diagnosed, patients usually get just 1 or 2 days before surgery. Usually when these patients come in, I tell them, let's try medication for this 1 day before surgery. If within this 1 day the pain and the infection decrease, then we don't need to do the surgery. But if the pain increases or if the infection worsens with symptoms like fever and vomiting, then you definitely have to go for surgery. That's what I always tell them. So I always approach such treatments with this kind of warning. We should know why appendicitis occurs. It's very important to understand this. Only then will we be able to properly understand its treatment. The main point is that neither modern science nor anyone else has been able to find a very clear reason for this. Often, it is said that the opening of the appendix gets blocked or there is fluid accumulation there and so on. As for why it gets blocked, modern medical science has not been able to clearly understand or form a definite picture about it. One possibility we need to understand here is that we have often heard and are familiar with the idea that appendicitis or the appendix is not an important organ. But still, if we look at modern books, I feel that the appendix is actually considered a very important organ. The main reason I say this is because of worms. There are 3 places in our body where these are most commonly found. One is our anal root, the second is the vagina, and the third is the appendix. These are the 3 areas in our body where worms are most prevalent. The appendix is said to have a colony there, meaning worms are located there. So if you ask what the benefit of that is, I can only guess. There isn't any major theory developed about it yet. However, people who have an appendix generally seem to have a stronger immune system. There are studies showing that when we cut and remove it, the immune system tends to decrease. So perhaps this might be happening because the spread of these worms could be increasing. That's what I think. When we talk about these worms, we know that if the number of worms increases in any individual, it is evident that many diseases also tend to increase. As I mentioned in previous episodes, a worm called pinworm lays an average of about 10,000 eggs. A single worm can lay anywhere from 10,000 to 17,000 eggs. And all these eggs hatch, and again, each worm lays this many eggs, and they too hatch. That is how much growth these worms are capable of. There are several theories that these worms might possibly block the opening in the appendix, and that can lead to swelling due to fluid accumulation. So I have often felt that one of the main causes of appendicitis is precisely this excessive proliferation of worms. So, if any of us wish that neither we nor our children should get this appendix problem or the disease called appendicitis, then the method that I would suggest, or rather the method that I have found to be the most effective, is to eliminate these worms. It is not possible for us to completely eliminate worms from our body. What we can do is reduce their growth or decrease their quantity in the body. In Ayurveda, there are very effective medicines available for worms. Once these medicines are given, we can effectively stop the strong growth of worms. From my personal experience and perspective, I feel that the main cause of appendicitis is the growth of worms. That's why I usually opt for that kind of treatment. But at the same time, if someone develops appendicitis and is experiencing abdominal pain, we cannot administer deworming treatment at that stage. There is a specific method for eliminating worms rather than killing them all at once. At that time, what we need to do is manage the infection. One advantage of Ayurveda is that we have internal medicines available. As commonly mentioned in Ayurveda, it's not just about taking medicines in the morning and evening. When an infection occurs, usually if we want to relieve the stomach pain within a day, we definitely administer medicine. By giving medicine every 2 hours or even every hour, we are able to eliminate the pain we have today by tomorrow. That is possible. In my experience, the inflammation of the appendix is a type of pain that can be relieved very quickly. Similarly, we know the external location of the appendix. It is found in the lower right side of the abdomen below the navel. That spot is called the McBurney's point of the appendix. It is at that location where we feel the pain of appendicitis. Appendicitis refers to an inflammation in that area, which is caused by a blockage of fluid. We have observed that when medicines that remove the fluid blockage are applied externally, the patient's pain often reduces quickly. If the pain and infection decrease within a day in this way, then it is possible to avoid surgery. However, if the appendix is already swollen, inflamed, and about to burst, then definitely, instead of using such medicines, surgery is the only option. We can understand this condition through MRI or USG scanning. So for some people, it comes back in a very chronic manner, sometimes mildly, but it doesn't progress to a severe stage. And there are people who keep experiencing pain at that same point of the appendix repeatedly. For such people, in Ayurveda, if we give medicines that reduce the infection in the initial stage, and then after the pain subsides, provide medicines that reduce worms, we can completely resolve this without any major complications. We may see another episode occurring again. Thank you.